There are a lot of other things out there here right now, and people call me, yeah, what do you think about that? What about this? Because the industry is bombarding you with advertisement right now. So I want to make a quick comment about these things. So recently there were 2 balloons approved where balloons are basically inserted with endoscope. You have an endoscope and there's a balloon at the end, and the balloon gets dropped into your stomach and it gets filled with fluid, and then they stay in there for 6 months and they keep you full because there's something in there, just like if you fill it up with food, there's something in there. So the balloons stay in there for 6 months and people lose weight, but then after 6 months it has to be taken out. And then you can wait another month and then you can put another one in. So this could go all your life like this. There's 2 problems with that. One is there are no real long-term studies, how much you lose and how much you keep the weight off. Your weight loss is not as good as with any of the other surgeries. It's not paid for by insurance, so that'll cost you a few $1,000s every time you have the balloon put in. So it's good for someone who wants to lose weight fast and easier for a specific goal, like medically, if you needed, like say, a transplant or some other procedure done and you need to lose weight, and then you can have it, and then afterwards you don't care if you gain it again. Or if someone has to go to a wedding and wants to look good in 6 months and wants to have that done and has the money, that's the way to do that too. So it's kind of like the reasons why people sometimes do that. There's a 3rd balloon, which is one that you swallow with a pill, and then it inflates. That's not FDA approved so far. That only stays in for 4 months, so even shorter weight loss. But endoscopy is just a little tube that you swallow. So that's another thing but it's not approved in the United States. And then there's another system called the V-Block or Maestro. That's actually surgery. It takes about an hour and a half. It's laparoscopic surgery, same 4 or 5 incisions. And then they put like a little electrode, almost like a pacemaker. And you have a little pacemaker underneath your skin and then some wires that go to your stomach and they kind of stimulate the vagus nerves, 2 vagus nerves, and that supposedly helps curb your appetite. And the results are so-so. When they compared several groups of people, one with and one without this, groups lost similar amount of weight. And the question was, is it because they had good counseling or is it because of the device? So again, it's one of those, I don't know, devices. The future will tell if this is going to work or not. So this is about these things. We don't do anything of these yet. We might in the future, but for now we're focusing on what's been proven over time.